Welcome to Neuroviax Academy, where we explore insights for personal and professional growth. Have you ever felt stuck in challenging patterns? Maybe negative thoughts, persistent worry, or habits you can't shake? What if powerful tools from the world of psychotherapy were accessible to help you navigate these? Psychotherapy offers a range of practical techniques that can significantly enhance your mental well-being and drive positive, lasting change. While used within formal therapy settings like cognitive behavioral therapy (CBT, many of these fundamental principles can be understood and even begin to be applied in your daily life. Whether you're a student curious about psychological tools or simply someone interested in practical ways to improve how you think, feel, and act, understanding these techniques is a valuable step. Today, we'll explore 5 core techniques widely used in psychotherapy, discuss how they work, and touch on how you can start thinking about implementing them. Let's begin by understanding a core principle often highlighted in psychotherapy, particularly in CBT: the strong connection between your thoughts, your feelings, and your actions. Imagine them as 3 points of a triangle, each constantly influencing the others. Consider this: a thought like "I'm going to fail" thought can trigger anxiety. Feeling leading you to avoid the task action? This avoidance then reinforces the initial fear, creating a loop. Many psychotherapy approaches, including CBT, help you recognize these loops and intervene, primarily by modifying your thoughts or actions to break the cycle. This approach is typically problem-focused, addressing current challenges, oriented, helping you work towards clear personal goals, and often time-limited, equipping you with skills for independent use. It's also highly evidence-based, supported by extensive research across many issues. Here are 5 fundamental psychotherapy techniques you can begin to understand and explore applying. The first, cognitive restructuring. Cognitive restructuring, this is a cornerstone technique in many therapies, especially CBT. It's a powerful tool for identifying, challenging, and rethinking unhelpful or distorted thinking patterns. We all have automatic thoughts, particularly when stressed or feeling down. Sometimes such thoughts are not accurate. They act like filters, distorting our view of reality as well as triggering negative moods. Think about common cognitive distortions ways our thinking can go awry: catastrophizing, overgeneralization, mental filtering, black and white thinking, or self-blaming. Cognitive restructuring teaches you to be a detective for your thoughts. You learn how to notice such automatic negative thoughts, look for evidence for and against them, and so evaluate alternative thoughts that are closer to balance and reality. This is not a matter of simply trading negative thoughts for unrealistically positive ones, but developing more flexible and accurate thinking patterns that correspond better with reality. The second, exposure therapy. Exposure therapy, a highly effective technique, particularly for managing fears and anxiety disorders, is exposure therapy. The principle involved is one of gradual, systematic confrontation of the situations or objects to be feared within a secure, controlled context. By confronting your fears with nothing feared happening, or by finding out you can manage even if it does happen, the anxiety response diminishes naturally over time through a process known as habituation. Your therapist assists you in developing a fear hierarchy, ranking situations you fear from lowest to highest level of anxiety. Then you begin with the least feared item, gradually becoming increasingly exposed to it until your anxiety subsides. Then progress up the hierarchy. The third, behavioral activation. Behavioral activation, this technique works particularly well for treating low mood. When feeling down, individuals will withdraw from activities that they previously enjoyed. This can set up a negative loop, diminishing positive activities and reinforcing low mood, low energy, and lack of motivation. Behavioral activation disrupts the loop by focusing on engaging in meaningful or enjoyable activities even when you do not want to do them. The core idea is that action creates motivation rather than needing motivation before you can act. By scheduling and engaging in positive experiences, mood and energy can gradually improve, breaking the negative loop. The fourth, social skills. Training. Social skills training improving interpersonal relationships is key to well-being. And social skills training offers practical ways to do this, particularly for those with social anxiety or communication challenges. Social skills training addresses skills such as eye contact, starting conversation, listening, stating needs, and coping with criticism. These skills are often learned by explanation, modeling, role-playing, and practicing within real-life situations. Enhanced social skills translate into better relationships, greater confidence, fewer feelings of isolation. The fifth, problem-solving therapy. Problem-solving therapy life inevitably brings challenges. Problem-solving therapy equips you with a structured approach to navigate these difficulties, reducing stress and increasing your sense of control. The steps are straightforward. First, clearly define the problem you're facing. Second, brainstorm as many potential solutions as possible, without judgment. Third, evaluate the pros and cons of each potential solution. Fourth, select the best option and make a plan to implement it. Fifth, review the outcome and learn from the process. Remaining sections follow putting these psychotherapy techniques into practice. You can begin exploring these strategies in your daily life right away. Start by simply observing your thoughts and actions. Can you identify patterns or distortions? Try gently challenging an unhelpful thought. Experiment with scheduling a small positive activity. Practice active listening in your next conversation. Use the structured problem-solving steps for a current challenge. Remember, practice is key. Like any skill, the more you use these techniques, the more natural and effective they can become in helping you navigate life's ups and downs. The ripple effect. Potential positive outcomes. Regularly exploring and applying these psychotherapy techniques can lead to significant positive outcomes, potentially reduced symptoms of anxiety and depression, improved relationships, greater self-confidence, increased resilience, and a stronger sense of control over your responses to life. Conclusion. Empowering your psychological wellness psychotherapy offers a wealth of tools. The techniques we've explored, cognitive restructuring, exposure, behavioral activation, social skills training, and problem solving, provide actionable frameworks to understand your mind and behavior and make constructive changes, while incredibly powerful for self-improvement and navigating common challenges. It's crucial to remember that these techniques are also core components of professional therapy. If you are struggling with significant or persistent mental health difficulties, applying these techniques on your own may not be sufficient. Seeking help from a qualified mental health professional is a sign of strength and can provide tailored support for complex situations. Think of these techniques as valuable tools in your toolkit, but professional therapy as the expert guidance for navigating challenging terrain. Understanding and exploring these techniques is a valuable step towards enhancing your psychological wellness. This has been an insight into essential psychotherapy techniques from Neuroviax Academy. Thank you for learning.